talk to you about age-related cerebral atrophy. In short, we call it ARCA. This is a very, very common disease that is coming up very fast. And all that we can do is we can make out and find out more about it. It has been estimated that 90% of people above the age of 90 have the disease. 50% of people above the age of 50 have the disease. That means we are looking at a very high number. Yes, does it relate back to any symptoms? That is still obscure. When the patient comes to us, they've already had a stroke or dementia or Alzheimer's. It's very uncommon that we may get the disease by just looking at the MRI. When we look at the MRI, we will see in the brain very deep sulci. Sulci are the ridges inside the brain. These sulci become very big. Small ischemic areas are seen where that means blood is coming less, and infarct. Then it goes in for dementia. Then the patient also has aphasia. That means he can't talk properly. He can't walk properly. So there's so many things that comes up from cerebral atrophy. It has been estimated that once we have a diagnosis of cerebral atrophy, the 10-year lifespan of that patient, of that person, is over 90%. That means 90% of them are dead in 10 years. Okay, so we need to find out more about this disease. What is the treatment? We really don't have any treatment except what we have, which is called morphogenetic activator of nucleic acid. What we do here is we take 1 drop of blood from the patient, make that patient's own fetal healthy DNA, fetal healthy stem cells, give it back as injection to the patient. This is that DNA or that molecule that made this human body in 9 months inside the mother's stomach. After he came out, he didn't grow another finger or a ear or nothing. So, if it is that DNA that made that body inside the mother's stomach, then when we get out this 1 drop, it will now repair that body. So, we have some chance of repairing microvascular disease or small vessel disease. It will not only affect the brain, it will affect the brain, the eyes, the heart and the kidney. Why? Because these are the areas of end artery. What that means is, an artery comes, he finishes. Then there's a small space in between, then the vein starts. So it's called an end artery system. Because of this problem, these patients develop white matter decay. They undergo cerebral atrophy. On an MRI, how do we make out? We can make out because there are deep sulci on them. There are small places of infarct. That means some areas of the brain are dead, and or the areas of ischemia. That means the blood is reaching less. But once we start giving the treatment, we can bring that patient back within 3 months. Optimally, we would like to go 1 full year. That means every month they have to come, because this is really one of the worst case scenarios. But we can do that in 3 months. You will find a change in the MRI itself. Now, what are the other investigations we need for this patient? We need to do their DNA sequencing. We have something today called clinical exome sequencing. We have found out approximately more than 30,000 genes, out of which approximately 10,000 genes have got a clinical significance. These clinical genes we can draw out and test them. We know exactly which base pair in which cycle it goes. So we know all the base pairs. We pass them through the clinical exome sequencing. This gives us an idea where are the mutations present. Once we know where the mutations are present, we can treat that patient even more effectively. Third, we need to do an hormonal assay. are the hormones that the brain is secreting coming normal for that patient. Because one of the most important areas that this disease tackles and you find a problem here is in the emotions. Because the emotions are controlled by the thalamus, the hypothalamus, the hippocampus and amygdala. This area itself gets an infarct when the patient goes in for depression. He doesn't know what's wrong. He has anger issues, mood swings. All this, if you find in an aging person, you can very well think that if it has started recently, there is microvascular disease or small vessel disease. Now in this case again, once we start the treatment, within 1 month you will find the patient will already tell you, yes, I'm improving, yes, I don't have that much of mood swings, yes, I do have anger issues, but my anger is coming down, my depression is coming down. They don't have anybody to complain to because they don't have a benchmark. They don't understand what's happening to themselves because they're just getting angry or they're going in for depression. Very, very often when we find above 50-year-old goes and commits suicide or murders, you've seen so many times, they'll take a gun, kill their family, kill themselves. All this, why does it happen? I'm giving you one of the reasons. And here, one reason that we can tackle. We can treat. The only way that we can treat is with morphogenetic activator of nucleic acids. Because we have this element which can produce that patient's own nucleic acid, which is RNA DNA, which is fetal in origin, thereby give it back to the injection, and the patient once again can get back his small vessel disease.
Madam, can I give the treatment for this diseases?
Sorry, sir?
Can I give the treatment in your hospital?
Yes, sir. Only treatment is available at our hospital because we are giving autologous healthy DNA back to the patient. Autologous healthy stem cells back to the patient, which belongs to the patient. We have not hunted anywhere for the stem cell. Usually stem cell we have to go to fetus or embryo. Here we are not doing any of that. We are making the patient's own stem cell. We are making the patient's own DNA and giving it back as injection. That DNA which made that human body inside the mother's stomach, that same DNA today will repair this human body.
Madam, can you tell the price of the treatment?
Sir, approximately one injection is 5,000 rupees.
Okay.
But you need more than one injection.
Okay.
Okay. Now for doing this, we need 3-4 investigations like I just explained to you, MRI, DNA sequencing and hormonal assay. Why we need the hormonal assay is because we need to find out, is this patient lacking in growth hormone, for example, luteinizing hormone, oxytocin, progesterone, estrogen, testosterone, any of these hormones are lacking. We can again give back hormone replacement therapy and or give back morphogenetic activator of nucleic acid. Within 1 month, even the hormonal assay becomes normal. This is a very, very big problem. It can affect anybody, most important people above the age of 50. Small vessel disease can also be treated with beta blockers. Beta blockers will have to be given for a long time. Where the heart condition is concerned, they need to reduce the cholesterol, so they'll give statins, they'll give a lot of other drugs which will pump the heart a little better. But brain, we don't have any of that. What to do, how to make the brain pump? There is no pump in the brain.
Madam, duration of the treatment, please tell, madam.
1 year, sir.
1 year.
Once we know that this is cerebral atrophy, we need 1 year. Because what is their main problem? They can't talk to you. Aphasia sets in, dementia sets in, and they have walking problem. So we need to treat it on a high level that he can start walking, talking and discussing with you, can go back to his normal lifestyle.